No movie can begin without the director.
Absolutely. Okay. Hi everyone.
Hi.
Good day?
Yes. Brilliant.
Brilliant. So I can't believe it's all done. And here we are. Thank you. The final session. I'm a little out of breath. I've just run from the very far end of the hotel.
That must have been 3 miles away.
Easily. So, we're going to talk a little bit about the Type 1 Origins comic book series. And I know these two gentlemen don't need any introduction. If you don't know who they are, you've been living in a different plane of the multiverse. So we've got Professor Partha Kar from Queen Alexandra Hospital in Portsmouth, and we've got Dr. Mayank Patel from University Hospital in Southampton.
Absolutely don't like each other.
No. It's a love-hate relationship.
Unfortunately.
We hate to love each other. So, we know each other really well. We're big movie fans, big Marvel fans, comic book fans, and avid Comic-Con attendees. So I don't think there's any surprises in what the inspiration was for the comic books. But can you tell us a little bit about the early days? Where did the idea come from, and how did it all start?
So I'll say a couple of things, and Partha will pick up the slack and end my sentence for me, because that's what us brothers do. For me, I've always been interested in medical education, teaching. I love teaching other students, other doctors, other healthcare professionals, the public, things like this, of course, fantastic. And it was always diabetes when I was a trainee specialist that really worried other people what diabetes is. They didn't really understand it, didn't really get it. So I tried to use my specialist knowledge and explain things the way they sort of would make them understand, in terms of just using everyday examples, lay word, lay speak, etc. And I think Partha mentioned in passing ages ago something about the fact that when young people or children get diagnosed, it's often their parents who are presented with some very sterile NHS branded paperwork or a leaflet that says, what is diabetes? And the individual who has the diabetes is perhaps, should be front and centre, isn't, because obviously they're young, they're a child, but equally it's their diabetes. It's important they are part of what's happening. So we always, Partha and I talked about how can we create a resource of sorts that might help for this demographic.
Yeah, so I think the idea came to me. I'll tell you the little story. And before that, I think a huge acknowledgement to Lee for everything you've organised today. And I don't think we'll find the opportunity, so a round of applause for you.
Thank you.
You can pay me later. And I think the important thing is that me, Lee and Mayank, believe it or not, we actually go to watch movies regularly together. And that's what we do. We've got a list for next year, don't we?
We do.
We do have a list.
It's huge.
And that's what we do. We sort of catch up as, you know, we're all work together and everything, but we are friends outside work, and we do that because we have a shared interest. And my idea came in the sense that I remember one young lady basically sitting in clinic and saying, you know what, type 1 diabetes is a bit like having a superpower. And I went like, how's that? And she said, well, it's a bit like having a superpower you don't really want and you really hate and you want to get rid of it, but you can't get rid of it. So you've got to find a way to live with it. And I said, oh, that's interesting. And she said, it's like the story of the Incredible Hulk, isn't it? And I said, he gets this superpower he really hates, and he wants to find a cure to it. And then obviously I knew Mayank and we had a shared interest. And I think what I'll preface this for the rest of the session to say, you'll hear my name's associated with this. I've got very little to do with this. This is Mayank's baby, left, right, and center. So my role is incredibly peripheral to this. I have no idea why I get dragged into these meetings. I literally don't.
It's a quota of numbers thing.
Yeah, so, but I really acknowledge the hard work he's put in. There's what, five of these different things he picks up. He works with the population, people who've got type 1, which I really like, and he sense checks them, so he'll talk about it. But I just wanted to acknowledge that, and I think do you know what the difference between me and Mayank is, apart from the hair? That too. Mike is literally, and I've said this, literally like the son my mum really wished she had. Right? So he's polite, he's kind, he's nice, he's very humble. All of the traits which have completely missed me by. Right? And Mayank is that, and we were talking about this. Mayank will do this shared reflective glory. He was going, no, it's not me, it's the team, it's Partha, it's Lee, it's not, it's Mayank. So I just wanted to start by so that everybody acknowledges that. So from me, a definite round of applause for that.
So. Okay, so the first comic book, Type 1 Origins, begins with the story of the young character being diagnosed with Type 1. Can you tell us a bit more about that? And then also the journey of the other comic books, because they all deal with different topics, don't they?
Yeah, so thank you. So essentially, for Type 1 diabetes, we know that obviously in the scheme of diabetes, people with diabetes, it's the small number of people living with Type 1 versus other diabetes types, and hence all the ignorance, the myths, the stigma, all of it, the horrible stuff that's out there. We want to set out and try and help others who don't have Type 1 diabetes understand what this means to live with Type 1 diabetes in a way that hopefully will resonate with them without being too medical or too clinical. So our first issue, we thought we have to tell us the origin story, obviously like Marvel movies do, where a hero comes from. And hence our first chapter was a chap called Gary, a chap at school who presents in a very textbook way and develops Type 1 diabetes. And it wasn't just me who had the idea for the story. We were very keen from the off to make sure that we absolutely captured the lived experience of developing Type 1 diabetes. So in the run-up to this, I recall talking to people in clinic, not because I didn't tell them why, but I just asked my interest, can I ask when you're diagnosed, if you remember, how did it all come about, just to make sure that I was being consistent, and ask them what was going through your mind, what feelings were going on, what's happening in your life, and we tried to sort of amalgamate those sorts of things, if you like, best we could, the lived experience of developing Type 1 diabetes in a young person and the first story. So Volume 1 dealt with somebody developing Type 1 and some of the early challenges they faced. And that went live in 2014, having started working in 2013. And what's lovely is that Partha and I were involved, and as were people with Type 1 diabetes. I wish I could draw like this. I wish I could draw like this. But GCSE art, so it wasn't quite up to standard. But Partha, in his Black Book context, knew Revolve Comics, what a particular interest in health conditions as their thing to do. Revolve Comics are based in Ireland, in Darien Island, Northern Ireland. And what's the wonder of modern technology is I've only met Danny physically, the comic lead, once in 10 years. For 20 minutes at airport as I was passing through, going somewhere else. The rest has been done, emails, phone calls, online, for 10 years. So it's been a really lovely thing to be doing that and embracing modern technology to be able to do it. So Volume 1 tells an origin story. Given they landed really well, was well received, which was lovely. Volume 2 we then thought, okay, every hero movie has a sequel, of course it does. And the question is making a sequel perhaps better or equal or not worse than the first one? And the theme at the time, by coincidence, in the hospital, we're going through a real run of people with Type 1 diabetes admitted with ketoacidosis, unfortunately, DKA. And it transpired that a number of people, unfortunately, despite their best efforts, had not been given the right advice or support around what to do when you develop ketones. And yes, I could have said, well, you measure your blood test, you take fluid. I thought, how do I turn this into an interesting comic book story? So, as with most comic book stories, there's a hero and there's a villain. And as we're movie nerds, as Partha's mentioned, to me the ketones were the monstrous villains of the piece. Being sci-fi nerds, we figured, well, Volume 1 was a superhero vibe. Let's give Volume 2 a bit of a sci-fi vibe. Hence, we took the parents, not for the youngsters. The Aliens movie was a heavy inspiration for that, depicting the ketones as acids. These alien monsters have acid for blood. Sorry, no scaring people. And hence, that was kind of the metaphor where that came from, as ketones were the villains of the piece. They were attacking, i.e. the metaphor for a ketoacidosis episode. And it played out in the real world versus the fantasy world. I'm not trying to give too much away in case you haven't read this. So that was Volume 2. Fast forward a bit further, Volume 3, okay, we've done ketones, we've done origins of the Type 1, what's left to cover? And we're like, well, where do you want to start? There's a gazillion things we could do. The next thing we thought was a big hitting topic, were two topics actually. One was hypoglycemia. Obviously the enemy of diabetes is highs or too low, and the challenge of maintaining and avoiding hypos is obviously the high stakes thing we're trying to do. So again, it's about how do we convey well, if you have a hypo, just take some sugar. That's a very short story, isn't it? I thought we could do a bit more than that. So by chance, there was some little virus pandemic thing going on apparently. You may have heard of it or noticed it. Horrific. And because of that, movie nerds, the last Daniel Craig Bond movie was delayed. You may remember, famously, was delayed. And we thought, well, how do we try and be a pebble on the side of the gaping hole that this delay is going to leave the country? We thought, we'll try something. And we talked about hypos, secret agent, spy story, how's that going to play out? We thought, the agent can have diabetes, let's do that. So we thought, okay, let's do that. And that's what we did as the hypo topic. Was this part of the time when Language Matters also came online? Do you want to say a few words about that as I pause for breath?
Yeah, so this was my tactics of saying he's in charge of it, so I don't have to do anything at all this session. Right, so Language Matters, and those of you who've got diabetes, I think one of the big things we always say is that, and I said in my last session, have some empathy when you're talking to people. And I always say this, you know, if you've got 5 minutes with a person with diabetes, what's the only thing you can do? What's the minimal thing you can do? People always, I said, there's only one thing, just be nice, right? That's it. 5 minutes of being nice is enough. So Language Matters was very much about that, and I think that sort of rolled into this thing called stigma, because I think living with type 1 has its stigma. Living with any types of diabetes has a stigma, and that's a bigger picture, isn't it? The debate then becomes, for kids, you're going to school, and they're going like, and your parents are being told, you shouldn't have fed your child so many cakes, and you're going like, it's got nothing to do with cakes, right? And you're going like, and parents are sitting there going like, which also is very unfair and unfortunate. A lot of people with type 2, because it's not simple as like just eat cakes and you develop type 2. So there's that narrative. But children themselves at different ages are being looked at. What does this mean? Diabetes means, are you overweight and all that? So we sort of try to weave that whole concept around of how you speak to people, making people understand the issues of stigma, what you need to avoid when you're having a conversation with people. So that was sort of episode 3.
Yeah, so what we did again, without giving too much away for those that haven't read it, we just tried to weave into narrative and really confront stigma head on by presenting it as, you know, in your face in the issue, as you'll see if you read it, and trying to offer counters as to some of the comments that people get with diabetes, type 1 diabetes, the stigma type comments, and try and counter those with what the appropriate response might be, for example. So it's just trying to find that way to redress that horrible situation when people feel stigmatised and demonised because of their diabetes. So that was volume 3, and then in volume 4, where are we in time now? 2022. So we fast forwarded to 2022. This was represented 100 years since insulin was first used clinically, which is a major milestone, of course, we know that. So 1922, January to 1922, Leonard Thompson, the first teenager, was to receive insulin. So we thought, what nicer way to depict that? And again, yes, Parthenope and I, Lee, could have written a paper on using insulin for the last 100 years. Yes, you know, could have just done some Word document. But no, actually, we're better than that. We can do a bit more than that. So what was lovely for me, a bit of a labour of love, really, because Parthenope in training, you hear of what was done back in the day with diabetes, how it's managed, glass syringes, you know, urine samples, tablets being fizzing and boiling every day. You've heard these stories, metal needles, you know, glass, all of it, reusing the same needles. So I thought, how better to depict that than do it visually? So yes, I could tell a story from 100 years ago going forward, you know, 1922 to present day, which we did, but because it's a comic, and we thought sci-fi time travel, let's do it backwards. So we did modern day, and took our young heroes back in time down to 1922 and rewrote some history that won't change the outcome, but it sort of told the story of insulin from a different perspective. And what was really nice is that we really did our best to highlight the key names, the key players in the last 100 years, Banting and Best, Frederick Sanger, there's a chemist, Dorothy Hodgkin. There's a few big names who've had major discoveries, scientifically breakthroughs, H.G. Wells, major breakthroughs, involvements, over the last 100 years. So we brought those into the story as well, as a kind of nice time travel narrative. And I recall reaching out at the time to these people, these families' estates, and a couple of us got back to us and said, thank you for acknowledging, it's really lovely. So that was nice to have that, you know, we'd hit the right note and they were tonally, and they were quite impressed that we thought about their family's ancestry and their contribution in that way. So that's our way of telling 100 years of insulin in a comic book. But there are textbooks written on insulin, I know that. But we wanted to get to the sound bites, the headlines in one issue, which I hope we felt we managed to do in a sort of comic book way, of course, giving nods to history and again, rifting from our favourite sci-fi type movies. So that was volume 4. And then, answer Lee's question, volume 5, yeah, there's 5 of them. So the story moved forward a little bit to a slight change of focus because, as Parthenope alluded to earlier, in hospital, an increased number of people with diabetes are in hospital for different reasons, and we appreciate it's not a perfect system. I'm not here to defend what happens, we do our best, but of course there's always lessons to learn and things to improve on. And I know for a fact firsthand, as Partha does, that a number of junior doctors and other staff who are not diabetes specialists are naturally not going to be experts. We can't hold them to account for that. That's just how it is, unfortunately. So we thought, okay, what other way can you inform at scale, which is I find myself doing often at work. Well, I'm one of me, how do I teach X number of people non-stop all year round when staff move on? What other way, rather than me having to find time 15, 20 times a year to do a talk, can I reach people in a different way? So volume 5 was nodding to the current interest in things called escape rooms. Yeah. So again, my original dream was to create an online interactive, IT-based interactive escape rooms. I wanted to do that, just way too expensive. That wasn't going to work. So, okay, next best thing, we'll do a comic book escape room in a sci-fi setting, of course, because that's what we do, and make the heroes 3 healthcare professionals who are not diabetes doctors or nurses or pharmacists, but in a way of making the reader think, oh, that could be me, junior doctor, that could be me, I could be that person. And again, we presented several scenarios in an escape room type setting, representing fairly common, everyday, as we see them, hospital-themed issues around diabetes care in hospitals. So that was our jump-off point for that. That went live late last year, and that brings us up to the modern day, where we are now. Did that answer your question?
I think so. So you talked about impact and trying to reach more people in an easier way. We've been very lucky because we've had hard copies of the comic books at the events and at our family camps that Partha and Mike kindly had printed, and I believe the hospital charity has paid for those. But really it's a digital download, right? So what has been the impact? I know that Revolve track downloads, but are you happy with how many people have accessed them, and patients and healthcare professionals?
Sure. So I guess for me, I think thinking sustainably, less printing is good. We all want to do less printing and less paper, we get that, we understand that. But we appreciate equally for some people, a hard copy is what people want, they prefer it, and that's absolutely fine. And we appreciate, of course, there are people not digitally literate who can get online very easily, so we understand. The challenge of printing hard copies, you've got to print in bulk to make it cost effective. So locally, we've got amazing university printers in Southampton who I've got to know quite well. They're a lovely bunch of guys. They very kindly do their best to make it economically attainable to print a certain number, but that equally it's not always possible to do all the time. Whereas equally a website, as Lee mentioned, revolvecomics.com, these comics can be accessed 24/7, 365 globally. And what's lovely is that we do track down, Danny from Revolve Comics does track the downloads periodically. I think the last count globally in 10 years, we've hit somewhere in the region of 28,000 downloads globally, thereabouts, which I'm blown away by, but I'd like to see a few more personally. But the issue we have is about how we spread the messaging and the word. So digital media path is obviously very good at this, very kindly often puts it on Twitter, X, Facebook, etc. Lee's charity, other charities all kindly, children's charity, diabetes charities all kindly advocate this. It's the latest DigiBeat package that Path has put on. DigiBeat for those children. It's in their package of resources. So we're hoping this growth through messaging that way, Lee, helps raise brand awareness. So in terms of downloads, we are happy. Can always do more. And on the website, what's the nice thing is that Danny has created a feedback option. You can just leave a comment if you like for feedback. So we've got some lovely, I check it periodically. We've had grandparents, 10-year-olds, healthcare commissioners, other sorts, parents, leaving feedback, which has been lovely to read the comments, all mostly positive, which is lovely. Some have asked kind of a hard copy sent to me in the post. We just can't sadly logistically do that. But we hopefully feel that by offering this online, free, globally, means that those who can find their way to getting a copy can do that.
Brilliant. And have you seen the audience expand? Because obviously first aimed at young people and educating young people, but lots of adults like comic books. And as a person with type 1, I've found them to be amazing because, when I was diagnosed a long time ago, there was not a lot of information. Now there's lots, but it can be a bit dry and it can be reinventing the wheel, and these are so different. So have you seen interest from adults as well as the kids?
So yeah, I'll stop. So for me, initially, that's a great question, thank you. There were people who used to say, comics, sort of, it's a bit childish, isn't it? That's the sort of comments I used to get from some people. Until they really learned what we're trying to achieve and looked at it, they revise their opinions quite often. And I think tapping into popular culture, I think, has been quite nice post-COVID as a way of just raising people's spirits a little bit. This comic is designed to be informative and entertain, but never take away from the seriousness of type 1 diabetes. We never want to do that. And I think, as I've heard the quote, going old is inevitable, growing up is optional. So I think for those who are young at heart and those who aren't, perhaps this just gives you a different modern take on an old disease, framed, presented in a more modern, different way. Any thoughts, Partha, or you've had locally, Portsmouth or Guild?
No, I think it's the way I look at it. Take a step back. People want to learn about it in different formats, and whatever format works for you. If it's a comic book, it's a good. If it's a blue and white NHS sheet of paper, that's what it is. It's about information. However you pick it up, I would rather people have knowledge rather than lack of knowledge. And I think for me, the reach, the importance of the reach, as I've always said, is probably slightly beyond the people with type 1 diabetes, because people with type 1 cares will know the information to an extent. What you want is somebody else to read about it and go like, okay. So for example, I'll just give you one very good example of one of the comic books where it was very nicely depicted that this child was basically missing school lessons or just falling asleep, or the teacher was telling the child off and their parents for their child not being attentive at school. Well, what was happening is that they were in the early stages of having ketones and glucose levels. So I think it's about raising that awareness, and Mike mentioned with DigiMeet. We want school teachers and everybody to be aware that if that's happening, don't just dismiss it as like the child's not paying attention. There could be something else going on. And as is the fear of every parent, what you don't want is that blue light into hospital because somebody's missed it at a very early stage and all he needed was a finger prick, right? So for me, I think that's a very important aspect of the comic book. Anybody else beyond the word, if you pick one child and saved one admission, you probably made all the comic books worthwhile anyway. So I think that's the way I look at it. It's the important bit, how do you move it out to other people? That's the important bit.
And you won a Quality in Care award from Sanofi.
Mine did.
Mic drop.
We did. No, again, very humbled that back in whenever it was 2015. The Quality in Care Awards recognise contributions to diabetes care through different services you provide, the clinics you run, or resources you create. We thought this was novel, we'll take a shot, take a punt. Never in a million years to be nominated. Wow, really humbling. So I know how competitive a process it is because I've been a judge before, not for this category, obviously. But I know how competitive it is and how tight it can be to make the cut. So to be nominated, wow, amazing, but to win it, we were blown away.
Fantastic. And I know that you've worked with a lady called Jaz Sethi on another comic book, which was for the audience in India, right?
Where'd that come from, that collaboration?
Yeah, so basically we've got very, very, very active type 1 diabetes advocates now all around the globe. And I think that's why type 1 diabetes is such a big, powerful movement globally. And in India, we have this young lady called Jaz, who does a lot of type 1 diabetes work, and she looks and says, well, we can do this. Okay. But I think it was a really nice, uplifting experience in the sense because they told the story from a very different angle. It was from a very Indian perspective, whereby the diagnosis would be different, the cultural issues would be different, but we had a bit of an interaction of the different worlds where our hero met their hero, and it was all good fun. But I think it was the growth of it which was quite important, and it was good to see that sort of attitude being picked up and that sort of whole ethos of that particular thing.
Yeah, and for me, I think it's about recognising the modern world. We have one disease, type 1 diabetes, but it presents clinically often in the same sort of way. But as Partha alluded to, the way it's initially managed or looks or how it appears and is received from the person or people around them, culturally, stigma, whatever, is an interesting story to hear from a different perspective. And again, we wouldn't want to feel that we're telling everyone's story just on our offering. So to have it culturally appropriate, I think, is a really important part of this, done by somebody who is in the know and in that world, who's going to be seeing it in the real world, who can give it context. So it's lovely to be part of the consulting process, but they very much, Jaz and her own company team, they developed in India themselves. We didn't get involved in that at all. They consulted, but they ran with it and produced two excellent.
You inspired them.
Inspired them to do it, yeah, exactly. Which is lovely.
Fantastic. So, and at the charity, especially with days like this, the whole thing is education, 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 and we know that repetition is key. So you can listen to the same talk about eyes or feet or diet 50 times. It's great because it's sinking in. And I think this is a good resource because you can read a comic book over and over, like your favourite book. Some information you might go, I've read this, okay. But I think as a resource, these are fantastic.
Thank you, Lee. So we also, aside from the comic story at the front, what we also do is Parth and I give a kind of preface at the start of the to set the scene, the context of what the story is going to vaguely be about. At the very back, we do give some real-world examples of resources you could look at, and then present a bit more medical information about the story medically at the back. So obviously you can see where the ideas come from, if that makes sense, to present the context in a bit more medical detail.
Okay, so we've got about 12, 15 minutes left. Has anyone got any questions about the comics for Partha and Mayank? Okay, Sophie.
I understand the financial issues about barriers around printing, but wouldn't it be amazing if you could have a set of these in a primary school, one set for others? Because I know from my daughter's experience, she's been the educator when she was diagnosed around her friends, and that's great. I'm proud of her for doing that, but I think that would be like the gold standard, wouldn't it, to be able to get this out, like you say, to a wider audience.
Yeah, let's do it.
And I don't know what, like, financially, I realise that's a big...
Finance. Right. No, I think that's a really good idea. So one of the things I really want to do, right, with this, let me tell you, which is why I work with DigiBeat to put it on their online platform. I think this needs to be with the Department for Education.
Yeah.
Okay, that's my next target. Once I manage closed loops, we get into that. But what I do want to do is have these, Maya doesn't know this yet, but what I do want to do is what you've just said, is for all schools to not only have an online version, but also have hard copies. Because this needs to be in the school, right? Because, and I think it needs to be more, and we won't talk much about what's coming in the next one. I think it's going to be relevant because of the explosion of technology also around.
You've said too much.
No.
That was my next question.
And the other thing there is that it also counters the narrative that came out once, I think it came out about 6-7 months ago, when the then Minister for Education said there should be no phones at all. And we were like, do you have any idea how it works? And they were like, no, not at all. And I was like, okay, that's just not going to happen. So then they made the provision in the law that if you have diabetes, you obviously allow that and all that. So that sort of narrative only stops when people are aware of the impact of technology. So that is certainly the plan. So it would be good to sort of catch up with you about that. But let me wrap this up because I'm just finishing on I just want to see how the DigiBeat school thing lands. Because because that's what I've said to the DigiBeat team, Tom's here from that team on that side, is that how are you getting it out to the schools? I want to know. That's the channel to also go, by the way, here are some hard copies of some comic books. And that's the reason we put the comic book there, because I know it will be quite attractive for the schools, right? And that's the next step, but it has to be there, I completely agree.
And I think picking up on Parker's point, which is a great, I love the concept of that, I hope it works, thank you for your idea. I think if more bodies outside immediate us pick this up and run with it, as a brand or education or something else, go with it, that'll help our case, I think. The more the word is spread to different territories, beyond our immediate NHS remit, that'd be great. Yeah.
What's your name?
Sophie.
Not you.
Oh,
Actual person.
Evie.
Hi, Evie.
Evie, right. We're gonna call it Evie's rule or something.
Yeah.
Yeah. We're gonna do something like that. We'll do that. Since it's your idea, we'll get it done. But no, we'll pick it up. It's definitely in my mind. So I think that's very important. Very, very important. Without that, I don't think we can crack it. So I think that it needs to be in the school levels. Maya doesn't know it yet, but how do you feel about this?
Fantastic. If it works, I'm going to warn out your local printers, they're going to be a bit busy.
It might be their budget then.
This is true.
Yeah.
But I think if you think about it budget-wise, you need to map out the schools, what schools we are targeting, primary schools, etc. And then, as Maya said, you do it in bulk from Central and put it out. So she's not here, but from Wales, Rose Stewart did some books, which is very much, Mammoth and all that.
Yeah.
So we did a massive bulk printing to send it out to all departments. So we got precedence of doing that sort of level of stuff. The question is, how do you then So we need that access into the Department for Education
Yeah.
to ping it out.
If anybody's got ways into that, please let us know.
Yes. Yeah.
Oh, really?
The Queen, you could look at some of the big charities like Book Trust.
Oh,
So they recommend.
is what we need.
Can you email me?
They're big in libraries, aren't
so
they?
glad you're here, guys. It's brilliant. It's what we need. Thank you.
Yeah, there's loads of big literacy organisations, and they will group their recommendations into things like medical features.
Well, if you
Thank you.
email,
Brilliant.
if you email me, and then I'll pick that up, because as I said, that's the next phase. I think next year I want to do that after, because I just want to see how the DGB thing lands in schools before then move it into the next phase. Evie, it's your thing now.
I was thinking of all institutions.
Oh, hang on a moment.
Sorry.
Here we go.
I was thinking of all institutions and organisations that there are, where, because diabetes is all ages and affects all, and sometimes if, so I was thinking, well, prison service, and it's not for them, but also for the prison officers and all of that, how to get more in, you know, it's relevant actually
It's
to
massive,
any
right,
age,
yeah.
and then the police, however you get that into, the police and then the county councils everywhere, because Hampshire comes under, you know,
Yeah.
Hampshire County Council, but Portsmouth has its own council, so each council, because when I did school escort role, we were shown the video on if they have epilepsy and if they have autism and how to what to do, what to respond, etc. Well, this is just that, and they were children, you know, so
Thank you.
all sorts really. To think big really,
Yeah, no, we
because
love- yeah.
and the cost isn't for you, like we're just saying, and definitely library books. There should be, you know, each different. There's community libraries where there isn't the council one.
I mean, I haven't
So
thought.
try and think bigger, and it's their cost, isn't it? But it's a public health thing, isn't it?
Yeah, that's something I hadn't
Sorry.
considered, just thinking now out loud about it. When Volume 6 goes live, hopefully the next few months, an omnibus of all 6.
Yeah.
And
example.
then there was universities with the teacher training. So they have teacher training, don't they, on all
It's
of
an-
this
it's a
somehow
world
or
I have
other,
very
which
little-
is
yeah,
before
you're
they
right.
even get to
Yeah.
the schools
Yeah.
and the education.
Thank you.
Yeah, and colleges and all age.
Yeah, we just need to get Mayank to stop producing more books. Every few years, it's like, I've got an idea. And I'm like, what?
No pressure.
No pressure. No. Sorry.
I was just going to say, I was completely unaware of the comments until I saw the programme for today's event. It's an amazing idea. My daughter was diagnosed through the ELSA study just over about a year and a half ago now, and we were looking for books for brothers and the whole family to kind of understand. Well, we are part of DigiBuild Beat as well, and we've seen things on there, but I haven't seen your comic on there. I don't know if it hasn't been.
The link is
launched
there.
yet,
There's a
or-
link. Yes,
I think
there
the
is.
school one just hasn't
the
introduced
school
it.
one. Yeah, I mean, it's great. I mean, every way you can get the message.
No, I mean, I think
out there.
also it's well, part of it is why we really appreciate DRWF's contribution to this. You know, it's a platform, right? We do it literally. It's done in Mayank's own time, right? He does it out of the goodness of his heart, and it's fantastic. So my role in this sort of whole thing is with my central role. NHS England had to push it and say that yes, we approve of it and it's great and all that sort of stuff. So, which is fab. So I think so the more we can get it out there, so the more better, and we'll keep at it. That's what we'll keep on doing. So.
And what I've enjoyed, thank you, that's very kind what you said. I think for me also, when Lee, rather than go to see a movie, I've almost got to, I'm not obsessed, but I go to a point when I see something for the culture. I always think, I could use that, or I could, you know, I just make a mental note, I could use that somewhere.
He's got a notepad and a clipboard.
High vis jacket.
We're like, shh, Mayank, we're watching the movie.
So I think just to give you an idea of what else, for example, Mayank has been a pioneer. It's a very similar concept. So he has used, for the first time, we have used virtual reality to do some educations around for staff. So you put it on and you can actually be there. And again, Mayank will never tell you about it because that's just Mayank. But it's a wonderful thing for staff, because what you do is if you put on the glasses or whatever you do, and it feels like you're in the room with somebody who's got DKA, and then basically then you're asked questions like, what do you think you should do now? and then one of the options is don't give insulin, and you're like, no, that's not the answer. That sort of stuff, which is very important, and I think I always say this. So those are the pieces of work which is outside the norm to try and change how people. This is cool, you know. People put it on, and it's quite a clever device because suddenly you're being asked questions, and the person in front of you is not looking very well. So what do you do as a doctor or a nurse?
And we were lucky because Parthos was interested in pushing technology in various formats in diabetes care, be it education, be it clinically, pumps, etc. But equally, we're all keen, as I said earlier, about reducing paper printing and going digital, and the use of virtual reality headsets. Any of you guys done that at all? Yeah, I mean,
Watch the TV program.
Yeah,
you
I
know,
mean-
they change the room.
yeah, that sort of thing. Let's think of that on steroids, okay? So when I was in, so at that part I worked with a company who specialist in building the scenarios, but there are no diabetes scenarios. That's right, Partha invited me to, create some diabetes cases. And when I had my first play with it, OMG, it was so immersive. The sound effects in A&E department, sirens, beeping, it was terrifying how realistic it was. You look around the room, there's a person there, you choose what intervention. It was brilliant. And I think, and that came at a time where increasingly, just so you know, around the country, more and more hospitals are using that VR resource to train staff because it's scalable. You don't have a teacher there all the time. People can do it themselves at scale, 24 hours a day if they wanted to, unsupervised, because it's a safe space. You're not going to hurt anybody. And you do these things, you get feedback afterwards, you go in again, and it's like Groundhog Day, and you keep doing it until you've hopefully nailed it and got it right. And to be part of something and that's quite as progressive and futuristic has been great.
One of mine's amazing talents is coming up with acronyms. You want to tell them what you call the program?
It's called DEVICE. That's the acronym. Diabetes Emergencies Virtual Interactive Clinical Education.
Very good.
What about other hospital trusts then have you gone to?
So these
That should be
the virtual reality is in the foundation year program.
That's national.
So
That has
that's
got
national. It's there about in different centres for that level of doc. We're trying to build something for nursing colleagues as well,
And primary care as well.
primary care. So we're trying to do those. Time is
And GP surgeries, where you have those things in your so if there's a short bit of this or whatever. So,
Yeah, so many options. So
you know what I
many.
mean, you have a
Like the post office queue telly.
The
Yeah.
ones that do have
I think
those.
there are lots of options going forward because right now the world is slightly changing with immunotherapy, ELSA, and all this sort of stuff, and all things are coming through. So what can we do to improve the education? And I can tell you, one of our biggest challenges has been to educate everybody just simply in CGM and making people aware that that thing in their arm has got a purpose, and now we got closed loop, so it takes time. So, right.
It's a vast task, isn't it? We talk about all of these things, but it's a huge task to get out to.
Once it gets rolling.
Yeah.
gathers whatever it
And
is.
I think it's collaboration, working together, healthcare professionals, charities, like you said, councils. There's funding. We have funding. You could speak to us. There's a conversation there. So after the event,
And children are on these school councils, aren't they?
Yeah.
So the children themselves can request to learn.
Yeah.
We want a topic on.
and there
So
are patients
that's-
on those panels as well for different health conditions. So after the event, we're going to have a digital hub. It's connected to our website. So everything that's happened today, all of the filming, the photographs, the exhibitors, they'll all be on there. But we'll also put a link to Revolve and where you can download the comics. So before we finish, any other questions?
Oh, can I just, sorry. I was just going to ask why I've never seen these posters in my GPs or the hospitals I've been visiting.
What, the comic
these,
books?
Like the comic
These-
books, the posters to advertise. Our
Sadly.
GP doesn't do anything like that.
To be honest, I mean,
Or our hospital, if you want to go
Or our
there.
hospitals.
where
Sussex, West
Okay.
Sussex.
Or East
So,
Surrey.
okay.
I'll let Parthos take this one.
Let me explain to you. This project that you see is 100% a labor of love in our own time,
Yeah,
right? So the first version was funded by me and Mike.
right.
We paid it, right? After that, we got more money from other places, NHS England and stuff. So I think the major thing is getting the resource to do it, right? I think my plan has always been, let's see how we can make type 1 mainstream and then use that to ride the wave. So I think type 1 now is, if you look at it in the sense of, when I started in the national role, there was no separate strand for type 1 diabetes. None. It was just diabetes. Which is why you have programs called prevention of diabetes, and you sit in there and go like, what? No. Right? So we always go, and the funny thing is now there is prevention of type 1 diabetes as well, right? So that's, so but now what we do is now we can get into the phase of, right, how do we really punch it through and get it all through? So that's probably the next phase that we go into, how do we get it to stop producing more books, and now actually now do the next piece of work. How do we get it into schools? We get into hospitals, GP surgeries, everyone should know more about. So that's the plan.
And the action figure range and the merchandise, yeah, that's coming next. Yeah, all the merch.
And then finally the Netflix movie.
Of course. Yeah, actually, and talking of movies, you know, there's not a lot of representation of people with type 1 in films and TV, so this is a great step. And lately,
what was the movie, the disaster movie that we talked about?
Greenland.
Greenland.
Yes.
Very good. If you have not seen it, you should watch it. Child with type 1 diabetes.
It's quite a central plot line as well for a change.
We need this on EastEnders or Coronation Street or something
That's
like
the
that.
change.
They
They did do it.
They
didn't
talk about
They did.
cancer and...
They do.
They did
Yes.
there was a diabetes protocol in...
What's an eating
Was
disorder,
there?
probably?
Yeah.
It's always in casualty at the minute as well.
Yeah, Strictly,
Yeah.
definitely.
It's always-
Nikki, because
We were thinking about other
Hollyoaks is the other one.
other situations where, you know, you go back and see disasters around the world, or like floods in Pakistan and stuff, earthquakes in China. What do you do if you've got diabetes? You're cut off from your insulin access or your healthcare providers. So Greenland was great, wasn't it? Trying to escape from, you know, this horrendous disaster, and stay safe.
And on Children's BBC, the Jamie Johnson series, which is about a boy playing football, there's a whole storyline that goes through a whole season about one of the players who develops type 1 diabetes.
Fantastic. Yeah, things are changing.
It's changing. I think, you know, for example, you had James a few days ago doing the CBBS reading of the book, and they're all, I think you've got more public figures coming out and talking about it, which is quite important, and I think that's a narrative. So, for example, and mine does the same thing. When we see somebody with type 1 and you see someone newly diagnosed and a bit like, what happens now? And I always say, look, you can win a Champions League football, you can be a French Open finalist, you can be the Prime Minister of a country, or you can just have a normal life.
You can be the villain in Happy Valley, you can be a James Bond actor candidate, you can be reading stories on children's CBBC bedtime stories, you know.
So I think we do these things with Leah's been to, we do these things where we say that I think it's hope, and I think that's the important thing. The message needs to be that it's not like you are cooked,
Yeah.
right? So that's the message we need to sort of get across. All right.
Wonderful. So I think we'll wrap things up there. Did you enjoy that?
Yeah.
Yes.
Thank you all
Very
for your
different
ideas.
talk.
Actually, thank you guys. Thank you.
And thank you to,
Can I just say,
yes,
my son was 21 when he was diagnosed.
okay,
And he also has a learning disability,
yes.
and we had no real support at all.
Another huge topic for another session that most definitely we need to talk about. So, big thank you to Partha and Mayank for spending the whole day with us and doing more than one session today. And safe journey home.
Has anybody had these, by the way?
No.
Just wanted to ask whether there was any best one you could recommend.
Okay,
Thank
so
you all.
who put their name in the hat to win the poster? So there's quite a few in there. I'm hoping that one of you gets pulled out because, you know, we could be here a while. So shall we ask Mayank and Partha to pull a name out? Here we go.
I'm not looking. Oh, the pressure's horrible. Don't hate me, whoever doesn't win. I'm sorry. We'll get more of those made, won't we, Lee? Yeah. You're all winners. Is there more cliches I can?
Yeah.
It's not about the winning.
Just take it out what you have.
All right, I've got my hand on one. Here we go. I'm committed. It's blue. Tilly Shields.
Oh, it's my daughter. She's colouring.
Ah,
Can I go and get her?
wonderful.
told everybody else.
Well done, everybody.
Think of a plan B.
Right, so that's it for a fantastic day. We'll tag you and release you all into the wild now. You're free to go.
Thank you all very much.
Thanks for coming.